This video specifically addresses hip internal rotation and hip extension. These typically don't present specifically as joint line or hip pain. They're probably going to present as SI or back pain. The reason being is at stance phase of gait, the femur has to internally rotate in order to propel the body forward. So if there's missing range of motion at the FA joint where the femur meets the hip, the big hip bone, there's that hip internal rotation and extension has to be found somewhere, and likely further up the chain, which is going to be the SI joint or the lumbar spine. So after you've evaluated that these are things that need to be done, there's a few things that we can do. First is just plain old FA distraction. So wrapping a band around the leg and the foot, and getting yourself into as much of an open pack position as you can, which is going to be 30 degrees of flexion and 30 degrees of abduction, and literally just let your hip hang. And you're pulling that femur out of the acetabulum, and you're trying to relax as much as you can and let the band do the work. Secondly is moving on to hip extension. And true hip extension at the FA joint is only about 10 to 30 degrees. Most people, when they walk with their spine for extension rather than engaging their glute and getting the range of motion at their hip. So an easy way to do that is to wrap the band around the hip, and you're trying to get the band as close to the hip socket as you can. And this is kind of a repeat from our hip flexor video. So this is more of a myofascial than you're actually shifting the femur in the joint. Back toes tucked under, both hands are on top of the knee. Chin is tucked back into a packed neck position. You squeeze your glutes and push down. Having that band have that extra pull forward, in theory, could help pull that femur forward and stretching the joint capsule. Secondly, we want to engage that hip internal rotation. So just simply adding hip internal rotation into an atlas stretch could be pretty helpful. You could try some general perturbations to see if you can get that to open up. Hip internal rotation, also stolen from Charlie Weingroff, is his tactical frog. So being in a knees apart frog position, your upper body is more in a plank position. You're actively engaging against the floor. You're grabbing it with your hands. You're creating tension with your arms. And as you pull forward, you pull that femur into internal rotation. It's a pretty aggressive stretch, not something that I give out to everyone. But you also have to remember the other hip ranges. Are your glutes tight? Doing a simple figure 4. You can also do it on your back. You can add a knee extension with it to increase that force a little bit. And a whole stretch. How many people can actually get into a full squat position? So if you wrap your band around your knee, around your back, and around your other knee, and then you can get up against a wall. And again, let the band do most of the work and try to pull yourself into more of a full squat position. Don't forget the ankle. Don't forget tibial rotation.